This is a Red FM podcast.
ਸਾਡੇ ਨਾਲ Honourable Judy Darcy ਜਿਹੜੇ ਕਿ ਡਰੱਗ ਸੇਫ ਸਪਲਾਈ ਮਿਨਿਸਟਰ ਆਫ ਮੈਂਟਲ ਹੈਲਥ ਐਂਡ ਐਡਿਕਸ਼ਨਸ ਨੇ, ਉਹ ਗੱਲਬਾਤ ਕਰਨਗੇ ਜਿਨ੍ਹਾਂ ਦੀ ਖਬਰਾਂ ਹੁਣੇ ਆ ਰਹੀਆਂ ਸਨ ਤੇ ਮਿਨਿਸਟਰ ਮੇਰੇ ਨਾਲ ਨੇ Honourable Judy Darcy. Minister, good morning.
Good morning to you.
Thank you very much for joining us today.
Well, I'm happy to. Whenever you ask.
Maybe you are happy, but some of your constituents are not happy today with your decision. I'm hearing that you are not seeking re-election. What happened?
Well, yes, my phone is literally clicking with messages that people are sending to me. I love my job. I love this community. And I will continue to be active in this community. But, you know, I've been minister for 3 years and MLA for 4 years before that. But altogether, I've been active for about 51 years. And it may shock you or may not. I will be 71 in November. And it's you know, you need to make a commitment. You need to be willing to make a commitment when you reoffer for 4 more years. And I just feel it's the time. I want to spend time with my husband of 44 years, who I love very much, my grandson, and just be involved in the community, absolutely. But you know in your gut when it's time to step aside, and it's my time.
Does it have anything to do with this untimely election that may be called?
No, I mean, the Premier, of course, has asked everyone in caucus and in Cabinet whether they plan to reoffer. That always happens in the year before, in the year before an election. So whether it's this fall or next spring or next fall, that question has already been asked of everyone. And so I've indicated that I wouldn't be reoffering. I mean, it has been the greatest honor of my life. To serve my community and to serve as a minister in the John Horgan government. I could not be prouder of what we've been able to accomplish together, and I'll certainly be working hard to elect my successor, whoever that might be. But also, you know, time for family, time for family, and time to have a more relaxed pace of life. And but I will never be far from working for social justice and economic justice.
I hope you'll continue serving until our addiction panel of Red FM, that overdose addictions. Would you continue?
Well, until there is an election and a new cabinet is sworn in, I'm still minister. Yes.
Okay.
So
thank you very much.
I am. Yes, and I'm working every single day. Working every single day. As you know, we've made a number of announcements over the last number of weeks. And so, one of my staff was asked, I heard a rumor a while ago, and was asked whether I was running again. She said, no, she'll never stop. She's a machine. Look at her, you know. There's more new programs all the time. So I was pleased to hear that. I have not slowed down. I will not be slowing down.
Mr. Going back to our overdose deaths, that's very tragic. And BC has done something monumental. Please give us more details about the safe supply of drugs.
Yes, well, we have been bold and courageous and innovative on every front because we need to be. And, you know, for some people, the answer is treatment beds. And so we have announced nearly doubling the number of youth treatment beds in the province because, as we've talked about, we need to start when people are young, prevent small problems from becoming big problems. We've opened up access to more counselling because counselling is a really important piece of healing and recovery. And we've also announced yesterday a major expansion of safe prescription medications as alternatives to people getting drugs on the street because that's what's killing them. That is what's killing them. We were making progress. You know, the death toll from overdose was starting to go down. Last year it went down by 36%, the first time since 2012, which is when the numbers started climbing. And then COVID-19 hit. And the drugs on the street, some of them have concentrations of fentanyl 40 times greater than before. And mixed with other drugs, that means even when you try and revive someone with naloxone, it doesn't work. So we need to separate people from those toxic drugs on the street. And an important way to do that is to provide a prescription alternative so that, like hydromorphone, for instance, which is a common prescribed drug, pharmaceutical, of course, only with a thorough medical evaluation. Right now, doctors and nurse practitioners are the ones who are able to prescribe, but we're going to be providing more training to registered nurses and registered psychiatric nurses, so they can also be part of the team that provides healthcare to people and provides, helps to get people on that pathway to healing, that pathway to recovery, and that pathway to hope.
Yeah, give us a little bit more details of that authorization that you have given yesterday to doctors and nurse practitioners. Registered nurses can also prescribe that?
Doctors and nurse practitioners have already been able to prescribe. The change that Dr. Bonnie Henry, our Provincial Health Officer, announced as a public health order, a provincial health order, is that there will be training provided to registered nurses and registered psychiatric nurses so that they can also be part of that team. And that means that we can expand the reach. When we are losing the most people ever to overdose, 170 to 175, every month for the last 3 months. I mean, this isn't somebody over there. Too many people like to think it's somebody else. It's some other, not my family, not my community. And that is not the case. These are people from all walks of life, in all cultures, in all communities, right across the province. And so we need to be able to make sure that all of the options, the one we announced yesterday, but also more treatment beds. We only have right now 104 youth treatment beds in the province. We've just opened a new youth treatment centre in Chilliwack with 20 beds, and I announced a few weeks ago 123 more. That means we'll go from 104 to 247, a significant increase, because our youth are our future. And if we don't support them now, this has lifelong consequences.
Minister, can you clear your policy that you're not trying to avoid the addiction, you're trying to protect people from dying, because safe injection sites and methadone and other legalizing marijuana, now this nurses can also write a prescription for the drugs. I mean, people will get addicted for sure, but you're trying to prevent them from dying. Is that correct?
Yes, people are addicted now. And people are dying now. Because they're using drugs alone, because of stigma, and so stigma, bringing down the walls of silence and stopping the shaming and the blaming and reaching out with compassion and care, not judgment, is absolutely critical, and absolutely critical for people getting the help that they need. But we're not legalizing anything. I want to be clear about that, and we are not letting up 1 minute about going after the real criminals, and those are the people who import these drugs. These are the big organized gangs. This is the criminals who mix these dangerous drugs that kill people. We're stepping up the pressure. They deserve to be punished to the full extent of the law. But individuals who are struggling with an addiction, that's a health issue.
But your slogan is not don't take drugs, say no to the drugs. Your slogan is don't do it alone, do it with your friends, and don't die. Is that how it is?
It's much more than that. That is the first step. Do not use these drugs on the street. They are poison. If you're using them, don't use them alone. But what we really want to do is connect people to help, connect people to healthcare, connect people to treatment and recovery, connect them to counseling, because the roots of addiction are very complicated, as you know. They often have to do, sometimes they start with physical pain. That means, and we certainly know that there's a large percentage, 1/4 of the people dying are men in the prime of their lives who work in construction and trades or transport. 1/4. So sometimes this begins with physical pain, an accident, an injury, and people turn to first prescription drugs and then perhaps street drugs. Sometimes it very often begins with psychological pain, with trauma in a childhood, or serious mental health issues that have not been resolved, that haven't been treated early on. But more often than not, when people turn to drugs or alcohol for that matter, if I could call it self-medicating, it's people dealing with their own physical or psychological pain this way. So the first step is to keep people alive, because we cannot get people to treatment and recovery and healing unless they're alive. But of course, we are pouring it on all across the spectrum of care that we need to have there for people. And that means expanding, for instance, the Roshni Clinic, a significant expansion of their services and their hours last year in Surrey. It's why I so welcome the work of the South Asian Youth Mental Health Ambassadors, who our government was able to give some funding to get going. They're out there really making waves, talking to young people about overdose, about talking to their families and the community, partnering with Gurdwaras and really saying, it's okay to say I'm not okay. Let's not treat mental health or addictions as a moral or a character issue. Let's treat it as
Minister, if somebody wants to quit some drugs, what are the options and what is the first step? Can you please tell us about the resource, any single resource?
Absolutely. There are many resources. People can go to 811 and find out about the resources that are available, but they are many and varied. So in Surrey, for instance, we provided funding for 2 community agencies that provide counselling, Diverse City and Moving Forward, and their services are available in Punjabi and Hindi and English and a variety of other languages. The Roshni Clinic, as I mentioned, and lots more information that you can find either on the Government of BC website if you go to COVID and then look for mental health, but also if you go to stopoverdosebc.ca. But really, people should be talking to their main healthcare provider. They should be talking to their doctor or their nurse practitioner. They should be going to a clinic in their community and really sitting down because, for whatever it is, whether it's finding a treatment bed, whether it's getting access to counseling, whether it's getting access to safe prescription medications, they need to sit down with a healthcare provider and just have a really honest conversation and look at the options that are available, because different things work for different people. And for me, in this world of addiction and recovery and overdose, there's a 3-letter word that is the most important word, and that's AND, A-N-D. Mm-hmm. Because we need to be, and we are supporting people with treatment and recovery options, with harm reduction, and counseling, and access to safe supply of prescription medications, and culturally safe and appropriate care, so that people feel comfortable speaking in their own language to people who understand their own experience. Mm-hmm. And people are more open are more open when they know that the person they're speaking with understands their life.
Minister, thank you very much for your time today. I look forward to see you at Red FM panel.
I look forward to it as well. Thank you so much.
Thank you.
Bye-bye.
Bye-bye.
Thank you for listening to another Red FM podcast. Don't forget to hit subscribe and check out our Red FM Canada YouTube channel. For further info, log on to our Red FM social media platforms or visit redfm.ca.